Hello.
Hello.
Welcome to your final exams.
Thank you.
Are you feeling comfortable?
Comfortable but nervous.
Yeah, I'm not surprised. Shall we get started?
Yes, please.
Alright, so what I'd like you to start with is the Schirmer test on either the left or the right eye.
Okay.
Alright.
Hello there, I'm SRP. I'm going to be doing your examination today. Let me just give my hands a clean. Right, so the Schirmer test is a test that checks your tear volume. A little strip there. I'm just going to fold the wick where the line is. I'm going to hook it just over your bottom lid. It might feel a little bit strange in the eye, but it won't hurt. And it won't touch the sensitive part. We have to leave it in for about 5 minutes. So I have a strip for the right and strip for the left, both labelled. Not touching the wick at the bottom to avoid contamination, and I'll do the right eye. So I'm just going to hook this over the bottom lid. I want you to look up for me please and keep looking up. There we go. You can blink normally but please keep looking upwards. I'll check the time there. I'm going to do Schirmer test. Right eye. Have to wait 5 minutes. As I say, this test is to check the tear volume. So I just need to wait now, the 5 minutes.
Right. What measurement is considered as very dry eye?
Less than 5 millimetres tear volume.
You've already asked the question that I was going to ask next. How long do you leave it, the strip in the eye for?
It's either 5 minutes or until the whole tip has become wet. So
Right.
I'm going to check that for the patient now.
Are there any other dry eye tests that you can perform?
A similar one to this is the phenol red thread. I could, using the slit lamp, check the tear breakup time with fluorescein dye. Or if I do a non-invasive one, that could be focusing on the first Purkinje image, asking the patient to blink and then stop counting when the image goes blurry.
Right, excellent.
Let me just check the strip. Right, so that's all filled up after just a couple of minutes, so I think the patient's producing, I've got a high tear volume there.
Excellent.
Okay, so I've removed that. And I've recorded um, 2 minutes full Schirmer strip.
Excellent. Right, next I would like you to do retinoscopy on each eye.
Each eye.
Yes, please.
Right. Okay, this test is to try and check the prescription of the eyes. I'm just going to be standing at this distance and shining some light in the eye, moving the light and just holding some lenses in front of the eye. So please look off into the distance, try not to look at me or the light, please. So hold the right eye to patient right and left to left shortly. I've calculated previously my working distance to be at 1.5 diopters, so that will come off if I'm not using those in the trial frame. just going to hold some lenses before your eye, but they won't touch. Okay, just the left eye now. You okay there? Thank you. Just one more lens to try. So ideally I perform this with a trial frame and with the working distance lenses in. Because we haven't had those, I've just taken off my working distance equivalent. So for the right I've got +1 diopter sphere, and for the left eye I've got a +150 diopter sphere. So just a mild hyperopic finding there, a bit more in the left. Thank you.
Right, what I'd like you to do next is do some measurements for new glasses.
Right, okay.
Okay?
So I'm going to do these measurements as if the patient's lost their glasses and they've come into the practice.
Yeah.
Do we know that what the prescription is or not?
You do know the prescription because they had their last glasses from us.
So I'm going on what's written
going
down
off their
here.
previous prescription.
Right, okay. Right, I'm just going to take some measurements of your eyes using the ruler. It's not going to touch the eyes at all. So first I want you to look towards my open eye there, please. And the other one. This one. This one again, and this one. Thank you. And if I hold that steady there, I want you to look towards my finger. Okay, just looking straight ahead. I'm just placing this just on top of the ear, measuring just in front of the lashes. Thank you. Okay. Now just look towards this eye, please. And down a bit. And this eye. Okay, that's all I can do with this ruler. If I had the Reese Fairbanks one, I'd take some additional measurements such as bridge, splay angles.
The thing is, we've got such a large display of frames anyway.
Yes.
Using those measurements, they should find something they like and can be used.
Right.
Right.
I think based on the prescription that's written here, which I didn't initially see, if the patient's going for single vision, I'd just go for standard CR39 based on the prescription. But I'm just going to write those measurements down. So I did distance PD, I got 66, near 62 millimetres, length to bend, and then just crest height. Okay.
Right, I'd like you to do conjunctival staining on both eyes, please.
Right. Okay, so I'm just going to check the integrity of the conjunctivas in the eyes. You have to pop a little bit of green dye into the eyes. Thankfully it doesn't sting and it doesn't affect your vision afterwards. In fact, it's pretty innocuous and it'll just drain out your eye naturally. Alright. If I can get it out of the packaging. And obviously not touching the tip there. Okay, I just want you to look up to the ceiling, please. You're looking up. There we go, just gentle dab on the conjunctiva. You don't need too much dye, just the slightest bit. And up again, please. Okay, just blink a few times. I'll be using some red-free filter, or a red-free filter on the ophthalmoscope. So I'd normally do this on the slit lamp with the red-free light. Okay, please look straight ahead to start with. Just focusing on the anterior globe there. Just look to your right hand side. And the left. Okay, up to the ceiling. Okay, is the brightness there okay? Okay, just need to lift the lid up just with my thumb, so look down for me, it won't hurt. Just checking the superior conjunctiva there. Okay, look straight ahead now. Okay, and for the left eye. Just continue looking ahead. And to the right. And then to your left, please. And up to the ceiling. And just down to the floor now. Okay, straight ahead towards the curtains, please. Lovely, thank you. Right, usually for staining I like to grade it and actually draw where the staining patterns are.
Yep.
So I thought there was some just normal grade 1 staining on the inferior part of the right eye and just the nasal part on the left, which I've drew there. Okay.
Right, so I want you to check the eye movements next as well, please.
Saccades.
Yes, please.
Right. So this test is non-invasive. It just checks your ability to move your eyes to change viewing position. So I want to be about 40 to 50 centimetres from the patient. Fingers about 30 to 40 degrees there. That's it. So I'm going to ask you to look between my fingers. So first look at my left finger there and the right, left and right, left, now right, back to this one, and right, left, and right again. Okay, thank you. So I'd like to do 5 cycles. Again, we grade the eye movement, so +4 would be smooth and accurate. I still think the patient's saccades are normal, but I'm going to go for a +3 grade because there was just this light undershoot in both eyes, but that's still considered normal.
And now for the final test for today. I'd like to do the eye care tonometry on each eye, please.
So this test just checks your eye pressure. The little probe on the machine just gently flicks the front of the eye, but it doesn't hurt and you don't require any anaesthetic drops. So I just need to set it up. So I'll just load a nice, clean, fresh probe there. Nothing touches the end. That just magnetises it. And to check your pressures, this is going to be very close to the eye, and I'm going to do 6 little flicks against the front surface per eye. Okay, just looking straight ahead into the distance, please, and breathe normally. Relax. There we go. A rating of 17. Let's try the left. Just relax. Very good. There we go. Lovely. And 16. Thank you. So if I record those down, let's put the time down. We do Tonometry. It's 3:28 PM. And also if the patient is under the eye hospital, I can give them a copy of their IRPs, or if they just want a copy anyway, if they ask, I can give them a copy on this little card here.
Right. Thank you very much. So we'll take these away, we'll get them all assessed,
Right.
and we'll let you know what the results are.
Okay.
Okay.
All right. Thank you.
Thank you.